Hello, everyone. My name is Dr. Tim Brown. I'm the Director of Interprofessional Education for the University of Georgia's College of Pharmacy. Welcome to PharmCast for the Community. Today, I'm speaking with three infectious disease practitioners throughout the state of Georgia. These are frontline pharmacists who are fighting against COVID-19. First of all, I have Dr. Christopher Bland. Dr. Bland is a clinical associate professor here at the University of Georgia College of Pharmacy. He also practices internal medicine in the Savannah area and deals with antimicrobial stewardship, or making sure we're using the right medications against the right pathogens. In addition, I have Dr. Daniel Chastain on board. He's actually in the Albany area and works as an infectious disease pharmacist, inpatient, taking care of folks that are infected with COVID-19. He is a board-certified infectious disease pharmacist. And lastly, I have Dr. Bruce Jones, also infectious disease clinical pharmacist, but in the Savannah area at St. Joseph's Candler Health Systems. He is also a part of a large citywide antimicrobial management program that's happening in Savannah as well. Today, I'm going to break this down to three sessions, gentlemen. First of all, I'd like to talk about prevention and who should get tested. In the second session, for those out there, we're going to talk about therapeutic options and over-the-counter medications. And lastly, we're going to talk about comorbid disease states, or those disease states that continue to be managed even in the course of the infectious process. So as we go through this, we'll have three different sessions, ladies and gentlemen, and each of the specialists will talk about what happens in each of those, and you can come back and listen at your leisure for 1, 2, or 3. So let's get started. I don't think a lot of people realize that pharmacists are actually in the hospitals, on the floor, seeing patients, those kinds of things. So I'm going to sort of talk our way through this, and I want to hear what you have to say about some of the media reports that's come out about medications, but also maybe a bit about what's going on in the various areas across the state. I'm actually located in Athens, so we do have a fair representation across the area and across the state of what's been going on. But Dr. Jones, one of the things that we've been hearing a lot about, and I think it's finally starting to sink in, is this social distancing. Is it a fair point to say that to reduce the spread of COVID-19, you need to be careful about distancing and who you're around and those kinds of things?
Yeah, I think so. I think I would start by saying that it's something we should take serious. I know a lot of different cities and states are doing different things, but it's something we should caution ourselves with, and that's whether you are seeing positive cases or even if you've had just a few, that is something to be concerned with. Because I'll tell you, in our institution, one of the things we're seeing is that it can take as long as 7 to 14 days to get a test result back. So, you think if you were exposed even a week before that, that's 3 weeks from exposure to a positive test. So I think this is something that's out there and it's everywhere. And, to this point, the two main interventions that I think we've seen the best results with are social distancing, as you mentioned, and hand washing and avoiding touching your face.
So one question I've been hearing a lot about, though, and I think it's sort of rising to the front again, some people don't even know they have or they are positive because they don't have symptoms, but they can still transmit the virus even though they themselves may not have symptoms, correct?
Correct. I think we're seeing a variation on how long it takes before symptoms come. There's certain patients that maybe within 5 days are showing symptoms. We've had some that can take as long as 12 days. And this, it ranges very much from patient to patient. As some can present with mild symptoms, some can be a lot more life-threatening.
So Dr. Chastain, I know that Dr. Jones just mentioned testing. That's been a big discussion in the media about when to test, who to test, where to test. Do we now have testing available in Georgia? Are we seeing people get tested, and how's that happening?
So we definitely have the ability to test in Georgia. How it's being done is through a variety of different avenues, one being inpatient testing. There's also testing at various different doctor's offices. I know, for instance, Albany has implemented a drive-through testing to where you can call a certain hotline number, talk with a nurse about symptoms, and they'll evaluate you as to whether you're a candidate for testing or not, with the big emphasis being on prioritizing these tests for those who are symptomatic. Kind of something that Dr. Jones alluded to just a second ago, of the long drag or long delay in turnaround time, really from the mass amount of tests that are being submitted, is only going to take longer and longer and longer to get some of those results back.
So they're doing sort of a triage, if you will. So if people feel they have symptoms of scratchy throat, high fever, those kinds of things, they can call their primary care or call the hotline to figure out about testing, to figure out if they have or they're positive for this particular virus.
Exactly. I think the biggest thing is, again, going back to something Dr. Jones mentioned, is that if you test negative, you probably were not ever infected at the time your specimen was collected. But that doesn't necessarily mean that if it's been a week since you were tested, you may not have become infected in that time frame. I also think that if we're having patients stand in lines for tests, then there's a possibility you stand next to someone who has it, and therefore you get transmitted or you develop that infection during that time frame of while you're waiting in line.
Thank you, gentlemen, so much for this first session of the podcast. You three have talked a lot about social distancing, testing, and when that should be done. Our next summit coming up, ladies and gentlemen, will actually be on the therapeutic options, or the treatments, if you will, as well as over-the-counter medications. Again, I'd like to thank Drs. Jones, Chastain, and Bland, but stay tuned. Second session coming up.